Ladies and gentlemen, and you know what? I'm really not shocked to hear this. The US ranks worse in maternity care mortality compared with 10 other developed nations. First of all, when you have your baby, the US think it is a sufficient amount of time, 6 weeks, for you to return back to work. I always said that was a load of garbage, and I still feel that way. That is way too soon for a woman to return back to work. You're not even healed from having your baby in 6 weeks. It takes some time. And that's the expectation they have here. And you can tell whoever made these rules up, I can tell it was definitely not a woman. So this is a recent report that came out. This is AJMC. It says among 11 developed countries, the US has the highest maternal mortality rate, a relative undersupply of maternity care providers, and is the only country not to guarantee access to provider home visits or paid maternity leave in the postpartum period. A recent report from the Commonwealth Fund concluded. Compared with any other Commonwealth nation, the United States also spends the highest percentage of its gross domestic product on health care. Maternal deaths have been increasing in the United States since 2000. Although 700 pregnancy-related deaths occur each year, 2/3 of these deaths are considered preventable. In an issue brief, researchers assessed maternal mortality, maternal care workforce composition, and access to postpartum care in 10 high-income nations and compared findings with the United States. Data from Australia, Canada, France, Germany, the Netherlands, New Zealand, Norway, Sweden, Switzerland, and the United Kingdom. They provided way better care than the US, ladies and gentlemen, and I'm not surprised. According to the World Health Organization, maternal mortality is defined as the death of a woman while pregnant or within 42 days of termination of pregnancy, irrespective of the duration and the site of pregnancy, from any case related by pregnancy or its management, but not from accidental or incidental causes. Overall, pregnancy related mortality in the United States occurs on an average rate of 17.2 deaths per 100,000 live births. The leading cause of death include cardiovascular conditions, hemorrhaging, and infection. And they said all of these things are preventable. However, in the Netherlands, Norway, and New Zealand, the rate drops to 3 or fewer women per 100,000. So just think about that. It's 3 or fewer women per 100,000 in the Netherlands, Norway, and New Zealand. And in the United States, it's 17.2 per 100,000. But these folks, ladies and gentlemen, run around telling you they invented medicine. And when you start looking at data, the more stupid they sound. For real. More than 50% of pregnancy related deaths in the United States occur after birth of the child or postpartum. Any death within 1 year of the end of a pregnancy due to pregnancy complication or a death during pregnancy is classified as pregnancy related death. A death that occurs within 1 week postpartum, 19% of all maternal deaths are largely attributed to severe bleeding. high blood pressure, and infection. When it comes to care providers, the United States and Canada have the lowest overall supply of midwives, and OBGYNs, 12 and 15 providers per 1,000 live births, respectively. Whereas all other countries have a supply that is between 2 and 6 times greater. Midwives differ from OBGYNs in that they help manage a normal pregnancy, assist with childbirth, and provide care during the postpartum period. In contrast, OBGYNs are physicians trained to identify issues and intervene should abnormal conditions arise. OBGYNs typically only provide care in hospital-based settings. The role of midwives has been found to be comparable or preferable to physician-led care in terms of mother-baby outcomes and more efficient use of healthcare resources. Who recommends midwives as an evidence-based approach to reducing maternal mortality. So the outcomes is actually better if you have a midwife. You know, my great grandmother on my father's side, that's what she did. If you go down to Osceola, Georgia, on the black side of town, because that place never integrated, it's still segregated, and the elderly people there, if they're in their 80s and up, my great grandmother delivered them when she was a midwife down there. Okay, so better outcomes with a midwife. Midwives provide most prenatal care and deliveries in the UK and the Netherlands, countries considered to have among the strongest primary care systems in Europe. Dutch midwives also deliver home births, which represents 13% of all births, the highest rate of any developed countries, the report says. Midwife services are not uniformly covered by private insurance plans in the US. No, because see, they want you to get overpriced by a bunch of doctors here. You know, they feel a midwife is getting in the way of them making the money. It's all greed. Why you don't have a lot of midwives in the US. It's greed. See, they rather for the money to go to these overpriced hospitals and these doctors and everybody, they want the money to go to them, not a midwife. Okay. Whereas both midwifery and OBGYN services are covered by universal health care in other countries. So, I mean, that's good to know. So, if you go to another country, a midwife is covered in your health insurance. Not here in America. Under the Affordable Care Act, Medicaid programs are required to cover midwife care, but the supply of providers is often too low that beneficiaries are often unable to access these services. State license laws, respectively, scope of practice laws and rules requiring physician supervision of midwives may all contribute to the low supply of midwives in the US. Well, because you don't really need all of that. Y'all just choose to do that, just inflate the prices of having a midwife. Medicaid also currently covers 43% of all deliveries in the United States, but only extend coverage for a maximum of 60 days postpartum. Furthermore, in some states, appeal courts have ruled to end Medicaid funding to Planned Parenthood clinics, which provide a number of health services for low income women, including pregnancy services such as postpartum care, and they also do abortions. Postpartum care include home visits by midwives also improve mental health and breastfeeding outcomes among new mothers and is associated with reduced health costs. Some Medicaid beneficiaries can receive these services in the United States, but all other countries include the report guarantee at least one visit within 1 week of birth, and that's from a midwife. So, I am not surprised that the other countries are doing better and they're using midwives and the US is doing worse and they don't. In the United States, non Hispanic Black women are 3 times more likely to have a maternal death than white women. And that's because we get much poorer health care than white women. White women have always got better health care in this country than Black women. So that's not shocking. Non Hispanic Black women are also significantly more likely to have a severe maternal mortality event at the time of delivery. Again, we get much worse care in this country. And you see that during COVID. Even with COVID, we see that with Dr. Susan Moore. We always get the worst care, but in the same token, you want us to trust you with this vaccine. Ain't gonna happen. When it comes to maternity leave, the Commonwealth report found the United States was the only high-income country that does not guarantee paid leave to mothers after childbirth. I'm not surprised about that. Again, greed. Greed. All other 10 countries guarantee at least 14 weeks paid leave for from work, while several provide more than a year of maternity leave. So they get in other countries 14 weeks to up to a year. In the United States, it's 6 weeks. Mm-mm-mm. But this country want to boast about being number one, and as soon as you start talking about, man, we invented medicine. Do you know how stupid you look now? I mean, just COVID alone makes you look dumb. You screaming all this time you invented medicine and you're doing worse than everybody with COVID. You look stupid. That should be a cue for you to just stop talking altogether. But y'all, please tell me what you think about this report. This is a damn shame, for real. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.